Buenas tardes a todos e a todas.
Good afternoon, everyone. Thank you for your participation in this webinar to strengthen the capability of the nursing personnel through graduate education. The objective of this webinar is to talk about the opportunities, challenges, strategies, and approaches to strengthen the capability of nursing personnel through graduate education, especially in the countries of Latin America and the Caribbean. We have a very interesting agenda. You will see participants from all the countries, and they will talk about the topic of the status of the graduate education in their countries, and also they will give us a perspective for the future of graduate education in nursing. To begin, I would like to invite Dr. Benjamin Puertas, Chief of the Human Resources and Health Unit in PAHO, WHO, who will address us in our opening, with his opening remarks. The floor is yours, Dr. Puertas. Good afternoon, everyone. I send cordial greetings from the Pan American Health Organization, from the Human Resources for Health Unit. We have been making important efforts to work with health professionals in the entire region, and nursing is a very important component of PAHO's work, and especially the unit that I direct. I would like to begin by mentioning a series of data that perhaps are known to you, but this allows us to position the importance of nursing education in the Americas. In the Americas, we have approximately 2,450 schools of nursing, many of them in Brazil and the United States, and there are 63 programs of doctoral training. And the majority are concentrated. 65% of them are offered in Brazil. And the number of nursing professional graduate education, and I am referring to master degrees, doctorates, and PhDs, is a very low figure if compared to other professional areas. Therefore, graduate education in nursing in Latin America and the Caribbean is a priority, and we have been working for many years in the preparation and implementation of national plans for strategic alliances. We work with collaborating centers in nursing in the entire region of the Americas. And also, we are aware of the series of challenges that we have in the area of nursing. For instance, lack of opportunities in education, especially at the BS level. Many countries have professional careers and professional histories in development of nurses. And also there's a lack of mentors and professors that should have the proper training and the required education. And also, on many occasions, we have had problems for advanced courses in interprofessional education. So this event that we are organizing here in my health unit and as PAHO, it looks to identify and have a dialogue space about the strategies that could strengthen the nursing graduate training in the countries of Latin America and the Caribbean. And this is just the beginning. For us, it is very important to have a policy that was recently approved by the member states in September 2023. This is the personnel policy for 2030. This policy has specific lines related to capacity building and also developing lifelong training for health personnel. So this is a priority for the organization. I would like to welcome all the participants, all the colleagues, friends, professionals from the entire region that have joined this initiative. And we are very interested in listening to you and having this dialogue with you. And we hope to have very good results in the short, medium, and long terms. Thank you so much. And again, welcome. Thank you, Dr. Benjamin Puertas, for your kind words. And for us, it is a pleasure to invite professors from our collaborated centers at the University of Pennsylvania, Professor Antonia Villarroel and Margot Brooks Carton, who will be talking about the opportunities, strategies, and challenges for graduate training in nursing in Latin America and the Caribbean. This is a very interesting presentation, and I am very sure that you will be interested in listening to this because they will be presenting the results of a doctoral training survey conducted among professionals of Latin America. We have simultaneous interpretation in English, Spanish, and Portuguese. And the presenters will be speaking English, but you can choose the channel where you have the icon where it says interpretation. You will be able to listen your presentation in Portuguese or in Spanish. Thank you so much. Professor Antonia Villarreal and Professor Margot Brooks Carton, you have the floor. Thank you so much. We have 400 participants in this webinar, and the number is increasing. Margot and Antonia. Yes, I am here. Thank you so much, Silvia. Welcome, everybody. It is a pleasure to be with you today. As Silvia has said, this presentation will be in English because it looks like it's more intelligent in English than in Spanish. First slide, please. Next one. Bruna. We have the screen. Can you advance the screen? Thank you. Thank you. I believe there is a problem, Professor Villarreal. Do you have any internet problems? Margot? Professor Margot Brooks Carton, could you please begin your presentation? Thank you.
Yes. Are we going to wait for the dean or should I start, Sylvia?
I think that you can start and maybe she can come by the end. Thank you.
Sure. Next slide, please. Our study was a collaboration between the University of Pennsylvania and PAHO, and the goal was really to understand common barriers and to create opportunities for collaboration. What we learned is that few or no PhD programs in the region of the Americas had PhD programs or funding for students, and few also had resources for development. This led to the collaboration and cooperation among schools in the regions of the Americas. Next slide. The purpose of our collaboration is to support capacity building activities to advance doctoral education in nursing in Latin America and the Caribbean. The rationale for the WHOCC is to increase the proportion and authority of midwives and nurses in senior health and academic positions and continually develop the next generation of nursing and midwifery leaders. Next slide, please. Our survey was conducted between November 2022 and January 2023. We received 174 responses from participants in 26 countries in South America, North America, and the Caribbean. 50% of the respondents held positions as professors in their respective institutions, and 43% of the respondents held positions in institutions that offer PhD programs. Next slide, please. Respondents were asked to rank priorities in 3 areas. 1, research, scholarship, and training, student support and faculty development, and curriculum and programmatic priorities. And again, this survey was developed as a part of the Penn Nursing WHO PAHO Collaborative Center activities in conjunction with PAHO. Next slide, please. When asked about their top priorities for research and scholarship training, 18.48% of respondents selected an interest in methods and designs for nursing research. Another 12.86% selected interprofessional and interinstitutional opportunities. 12.86% of respondents selected activities to support discovery and innovation. 11.78% reported an interest in grantsmanship and developing a research proposal. And finally, 11.23% selected translational science, specifically building skills in interdisciplinary and translational science and the role of innovation. Next slide, please. Survey respondents were asked to select their top student support and faculty development priorities. 25.46% ranked building faculty and academic leadership capacity and creating an intellectual community, building scholarship capacity to guide and advise students in 1 or more substantive areas as their top choice. 16.97% ranked advising and mentorship. 16.74% selected funding support for students. 16.28% selected work-life balance for students. And finally, 12.16% of respondents selected an interest in continual development of faculty members. Next slide. Our last area of inquiry on this survey asked survey respondents to select their top curriculum and programmatic priorities. 14.67% of respondents expressed an interest in curricular innovations needed to prepare the graduates of research-focused programs. Next, 13.67% expressed an interest in ensuring quality and rigor of training programs. And finally, 12.17% desired training essential resources for a successful research-intensive doctoral program. Dean, would you like to share our proposed upcoming webinars in the next slide?
Yes, thank you. Next slide. So sorry for the technical difficulties. Based on the survey results and also in collaboration with our PAHO colleagues, we are proposing to develop a number of webinars that we hope will assist in capacity building for doctoral education throughout the Americas. One of the first issues that came up was how to support students. So we are going to be planning a seminar based on a practice that we use widely at Penn School of Nursing to develop individual development plans for our PhD students. Secondly, we also know faculty need help in terms of developing their own programs of research. And so we want to share with you exemplars from our faculty. And then finally, we're going to look at sharing curricular innovations and approaches specifically for research-focused PhD programs, how to engage people in research, publications, and other areas. We would invite you to share your comments and thoughts about the webinars that we propose. And we would also invite you to, if you have skills or areas that you would also like to share to be part of these webinars, we would welcome you. So please put those items in the chat. Thank you. Sylvia.
Muchas gracias, Tony. Muchas gracias, Margot.
Thank you, Tony. Thank you, Margot. It was really interesting to hear some of the results of the survey. Because of time limitations, we cannot go deeper into detail, but I think it has caught my attention, this topic of curricular innovations. Yes, since we had the pandemic, we see at Bajo the need to innovate curricula in the training of professionals, both at the graduate as well as the undergraduate levels. Also, it is interesting to see the need expressed by the participants to support training of the faculty. We see that there is a very small number of faculty members in the schools of nursing in our countries that have the PhD or doctoral training. And it is important to search for this, to look for this, because that way we have professionals who are better qualified, who are more innovative, and who can really participate in the long term in the training of others. So now we will hear our next participant, who is Dr. Nelson Martinez Trujillo from the National Public Health Schools of Cuba, and she will talk about her experience with the graduate training in Cuba and other countries. Dr. Nelson, thank you so much for your participation. And thank you, Margot, and thank you, Dr. Villarreal. And then Dr. Nelson Martinez, please go ahead. Good afternoon. We thank you very much for the invitation to participate. I am here with the head of the nursing department of the Ministry of Public Health, and this is a very pertinent topic. This doctoral training is important. Doctoral training and the analysis made through a survey, representative of nursing personnel. We see the number of people who have had graduate training in Latin America and the Caribbean. If we talk about science, doctoral titles and others, we can have to see what is the persistence of these trends through time. It is important to see what phenomena we have, and then it is important also to analyze the context and the specific traits of all of these programs, and then the number of people trained. So the first thing, do we have any doctoral candidates for sciences? Well, we have to develop scientific thought, and then we have to conduct surveys to make sure. Is it only important to just have a title, or to keep on training those people who have attained this title? This first question takes us to a risk analysis. In the doctoral training, we have to think of numbers, or do we have to think of quality of those numbers? Well, we have to think in terms of the transformation that these trained personnel can achieve. Yes, in scientific formation or training, we have to think of research programs, interdisciplinary programs, and intersectoral programs, also within a specific context. Also, we must underline the training of these doctoral professionals can do of everything that they can do with their training in the scientific field. And also, we have to understand that doctoral candidates for sciences also have to work in policy development and in general health for the countries. So when we talk about doctoral training, we are not talking only about doctoral training in nursing. Yes, of course, we have to have nurses that can access PhD and other doctoral programs, but also they have to have intersectoral training. In Cuba, doctoral training began in 2006 when the first professional had the degree of PhD in sciences of communication. And then we started with nursing sciences in 2006 too. And we work with the University of Manitoba in Canada. And that is when we started our doctoral training for our professionals. At the present time, we have at least 80 professionals with a degree of Doctor of Science in Health Sciences. We have health sciences, sciences of medical education, and then the number of nurses that have PhDs or doctoral degrees are in the nursing professional. All of these skills that the professionals should have are there. And the results of this training has given us a result the improvement of sciences in the public health sector, in medical education, in innovation within the curricular programs, also in the development of virtual sites for all of this training. So doctorate in sciences for medical education has really opened up many opportunities. In the case of the teaching sciences, we have been able to evaluate the impact of undergraduate and graduate programs. Doctoral programs in nursing sciences in the context of Cuba has given us models and excellent programs to formulate theories of research for nursing in the different countries. So, and then I said one of the main rewards of these programs have been really national and international models for these nursing sciences. So we have really many fields of research that have been developed and have attained the best results in this area.
In the case of science PhD by Cuban nurses, has been very popular in the country, and also the Public Health Ministry and its nursing department have been very active, and also we have an agency for the doctoral training. This is good for a profession for the national health system. And the challenges for doctoral studies in Cuba and the Americas is first of all to link doctoral education with the reality of social context where programs are implemented, and that the results are an evidence for social training. So we not only see the degree, but also sustainability and social training over time. Also, we need to increase the number of service graduates because most of science doctors come from the academic. For example, the sciences doctor in our nursing school, but we also consider and believe that the development of science doctors and other professionals in service is also a challenge in the profession. Another challenge that we have in doctoral education is to increase the number of subjects involving nursing professionals with health policies to bring evidence for service training and for the construction of systems, but we also need better conditions for leadership positions in the health service. We also consider that it is a challenge to increase the graduate education. There's an important cohort in Cuba and Latin America, but we also need to give access to more graduate education to have sustainability over time of our results, and also to make methodological proposals to address these problems within the professional practice. Another challenge has to do with having sustainable studies when it comes to the results, and also to incentivize multi-sectoral research. That is to say, to involving different contexts and different themes, because we also need to have a comparison among all countries to know where we stand. And finally, I would like to say that this webinar should lead to important debates about the importance and reality of the education, the doctoral education. It's important to increase the number of doctors, but also that when they have been trained, they continue to be valuable agents for the profession and for others. Thank you very much, Nelson. Excellent presentation. Anaí, my greetings. Anaí is the head of nursing at the Cuban Health Ministry. It's a pleasure to see you, and I'm sure we will have many comments at the end. Please stay with us, and then now we move to the next presenter in the panel, Maria Liliana Calderon Macías of the State University of South Manabí, Ecuador. A pleasure, Liliana. The floor is yours. Good afternoon, everybody. Greetings from Ecuador. Nelsie had a very interesting presentation, and we agree in many points. She addressed 3 key points in graduate education, and based on the results of the survey conducted by UPenn. And one of the issues that for me is essential is that we not only have to increase the number of graduate professionals in the area of nursing, but else to give them a name, a surname, increasing the number of nurses with graduate education in nursing. It has been said that the nursing profession is at a crossroads. We have made great strides, but we run a great risk of departing from the core of the study, which is the study of care. We have to be very careful when getting trained as doctors, but also we have to take into account this, which is so important. That is to say, to get trained as doctors, as professionals. Until a few years ago in Ecuador, we only had 6 doctoral nurses. Now, lately, we have already 18 such doctoral nurses, and now that number has increased to 66. Most who are having graduate studies favor studies in public health. This is not bad. On the quite the opposite. This is very good because we are training, we are studying, we have increased the number of doctoral graduates, but we have to take advantage of this new knowledge, of this new approach to other science, to align this with our discipline. As you know, nursing has its own body of knowledge, but it has also taken knowledge and theoretical aspect from other professions. And so it's important to approach other types of doctoral studies other than nursing, to bring elements from those other areas to nursing and not the contrary. We have to keep the focus of nursing in health. And another of the results of the survey is that 50% of respondents are members of academia or are university professors. And this reinforces what has been said, that this discourse of the importance of graduate studies in nursing cannot yet move beyond the academia. As Nelsie said, this is a constant concern in our academic environment, but we cannot yet reach wider spaces such as the administrative and care spaces. And the fifth role of nurses is the political role, the representation of nurses in trade unions. We, as standard bearers of all this, as to the importance of nursing, we have to take advantage of these training programs and education programs we have in our universities, is to frame into context what is happening with nurses and their professional environment, and link them to professional colleagues who have not been able to follow graduate studies. And they need to be made aware that graduate studies are important to improve our professional practice. And now the third thing, nursing graduate studies. Nursing graduate studies are crucial to improve the practice of nursing, because thanks to nursing research during these graduate studies, during the graduate education, that is how greater knowledge is generated, both theoretical and discipline, and our discipline. Practice is the raison d'etre of nursing. That's a dictum which is very important. Hence, all knowledge generated around this practice to innovate and reform should be taken to move hand in hand with other science. Just as other health-related sciences evolve, the same thing has to happen in nursing graduate studies. Additionally, within what we call the discipline development of nursing, there are criteria for us to become members of a professional discipline, and in that criteria is one of the most basic elements to support this discipline development, because it is through these spaces that the academic debate starts concerning the importance of continuing training and to be up to date with current innovations. Going back to nursing graduate studies, they are crucial. Why? Because they are spaces, as also Nelsie said, these academic debate spaces are niches to generate larger processes, such as the creation of academic networks and the deepening of pertinent topics in nursing, academic contacts, and science and information dissemination, because all of this is in the literature. And nursing professionals, it is said that we do research and we have practice, but there's still a need to write all this down and to disseminate it, to give all this more visibility. And what role then do universities or graduate nursing institutions have? And that is something mentioned by the survey respondents. We need support to follow nursing graduate studies. That's not necessarily easy. Not all our professional colleagues have the space allowed in their jobs to follow these studies. Within a research I conducted for my doctoral graduation, PAHO is fundamental in Ecuador to support graduate studies. Since the mid 20th century, PAHO has supported graduate education of teachers with scholarships in nursing teachers, which made it possible for them to perfect their training. And so universities also have to look at all these areas in the field of graduate studies, because not all universities, and this could be one of the reasons for the lack of advance of nursing graduate studies, and that is the lack of support from universities to teachers who want to perfect their training. And sometimes these professionals need to use their own resources to follow graduate education, but other countries have teacher scholarships and other similar systems that allow professionals to continue their training and to follow graduate studies. Now, when it comes to the PAHO support, I would like to take advantage here to invite PAHO to look at the case of Ecuador. Here we don't have a graduate program in nursing. The scarcely 18 nursing professionals here, we trained in other countries, but now there would be the opportunity to start with PAHO support and other countries present here to start thinking of a curricular graduate process, because that would be essential, because the knowledge generated in graduate studies in nursing is discipline knowledge, which will transform our profession. Because to do research in nursing, we need to know what problems arise in the practice. And so here we have the research, theory, and practice. All of this has to underlie the training of nurses in Latin America. This is my message to you. Thank you very much, Liliana. Excellent presentation. We need to see the chat, whether there are many comments and an active debate. So this is a very interesting topic for PAHO. Now I have the pleasure to invite Dr. Dawn Monroe, who will speak in English. She comes from the PAHO WHO Collaborating Center for Nursing and Midwifery Development in the University of the West Indies School of Nursing in Jamaica. She will present her vision. Those who are listening to the channel in English, in Spanish, go to the Spanish for the interpretation, because the presentation will be in English. Thank you very much.
The floor is yours.
Thank you, everybody, and good afternoon, good morning, good evening. I'm sending sunshine from Jamaica. Nancy's presentation represented the Jamaican context very well. I will share with you everything that my two other panelists said is very applicable, and I do not want to repeat. So I will just share some unique perspectives from here in Jamaica. In Jamaica and the wider Caribbean, nurses access graduate education through master's programs primarily and doctoral programs. At the University of the West Indies, there are 4 tracks. There is an nursing administration, nursing education, nursing, the family nurse practitioner, and the mental health psychiatric nurse practitioner. Our PhD program only started in 2012. So even though the nursing program started from in the 1960s, it is only in 2012, 2011 that we introduced doctoral education here in Jamaica and the wider Caribbean. Our PhD program offers 3 majors: nursing administration, nursing education, and clinical nursing. And this is really important. In our PhD program, even though we started in 2011, our average enrollment over the last 5 years has only been 5. So it means that even though we do have a PhD program, the enrollment is relatively small. In one of our largest universities, the number of faculty who are doctoral prepared is just 15%. And this is really important. Among those who have gotten graduate education, we have seen increased competencies in curriculum development and the use of contemporary pedagogies. We have seen enhanced nursing leadership and negotiation skills and administrative competencies. We have seen increased competencies related to gender issues in health and evidence-based practice, as well as clinical nursing science. Yet with all of these gains, we are still struggling because it is not enough. It simply is not enough. While the gains are small, though, we have seen where doctoral prepared nurses have given credibility and visibility to the profession. A nurse with a doctorate is highly respected here in Jamaica and in the wider Caribbean. And we're seeing this in relation to how nurses are consulted in interprofessional teams that go into communities to administer to the needs of people in primary care settings, which is really very important. So we have seen a strengthening of interprofessional collaboration because of the increased credibility and visibility through our doctoral prepared faculty. Many of our master's graduates are employed in leadership positions, but what we are seeing is that there is ambivalence of non-academics towards doctoral education. One of the developments in Jamaica is the granting of prescriptive rights to advanced nurse practitioners. This is providing a unique opportunity. And so as one of the ways forward, what we have begun to do is to explore the development of a doctorate nurse practitioner program that is based here in the Caribbean. Many of our nurses do complete doctoral education, the Doctor of Nurse Practitioner program, but they do that in the United States. And I'm so happy that Nancy and the team there is looking at how the capacity within the Caribbean can be developed to offer and to strengthen this kind of innovation. We also recognize through this development of the granting of prescriptive authority to nurse practitioners is the need for competency-based curriculum, which means that we need to strengthen our capacity to develop competency-based curriculum. Some of our doctoral candidates are engaged in nursing education innovation, but not enough of us are looking at competency-based curriculum. So we're seeing that there's an opportunity here to explore and to develop competencies in competency-based curriculum, which is really important. And finally, we also need capacity building in implementation science. The two speakers before me talked about the importance of having doctoral prepared nurses who are not confined within an academic setting, but might be in a clinical setting. The ambivalence is something that we have to explore to understand why is there ambivalence to doctoral preparation among non-academic nurses. Not academic nurses have an incentive to engage in doctoral education because not only do our careers depend on it, but also it helps to strengthen nursing science. We need to understand why is there ambivalence towards doctoral education among academics, because it is having nurses who are trained in advanced clinical competencies, who are able to translate evidence to evidence-based guidelines that can be implemented in patient care that is going to strengthen the quality of care that our populations receive and deserve. Thank you so much for this opportunity, and we look forward to the ongoing debates that come out of this important webinar.
Muchas gracias, doutora Dawn.
Thank you very much, Dr. Dawn. A very important contribution to this discussion from the viewpoint of the Caribbean. We have listened this afternoon to a very interesting discussion of countries in the area of financial support, scholarships, and the chat has many comments about the possibility to strengthen links among universities within a country, but also outside of a country. It's important to think on this, how we can work collectively, not only thinking on the possibilities inside our own country, but also approaching universities of other countries. You heard clearly that the University of Pennsylvania Collaborating Center, we heard their approach to strengthen the topic of graduate studies in Latin America. We have many comments about the recognition of roles, not only for education, but also with good salaries for professionals who have trained in their profession. And also the political role is very important. We know that a professional who continues educating and researches and looks for continuing training and continuing education, and who produces and consumes education can also have strengths in his or her qualification and that of new nurses. We have heard about the graduate doctoral opportunities in other areas different from nursing, and with the possibility to strengthen interprofessional teams. So we also heard about the quality of education, not only thinking at the graduate education, but also not only undergraduate studies, but also graduate studies. And you also heard about the importance of developing the nursing science. And since we now have 3 more minutes, I would like to ask to the presenters today, how do they envisage the future of nurses training at the graduate level? We talked a lot about the undergraduate level, but what do you see for the future to once again strengthen the training? Maybe a couple of strategies that you think that PAHO should support going forward, but also that we can develop jointly. First, Nelsie, who was the first presenter. Nelsie, have you been listening to us, Nelsie? Yeah, I was listening. I refer to the possibility to create academic programs with a multi-country basis to support graduate training in different contexts. This is a way to help and promote graduate education in nursing and other disciplines. We could analyze this in greater detail to pool resources. Thank you, Nelsie. Liliana, from your viewpoint, how do you envisage the future? What strategy do you think that we would need to develop? You have already said a lot, but maybe if you had to select 1 or 2 points, what would you say? Well, undergraduate studies are fundamental. The education of research competencies would help to have our students fall in love with our profession and to approach better graduate education to transform their practice. That's number one. Number two, creation of laws and policies for nursing. In Ecuador, we don't have a law protecting our profession and our practice. And we should be granted rights to have permits from our work or jobs to do graduate studies and receive scholarships that all our colleagues have said are critical to improve our graduate studies.
Dr. Morrow, can you hear us?
I was not hearing just now, but I am hearing now. So I have 2 points. One is one that I mentioned. I just want to underscore the development of implementation science, a focus on translating evidence into evidence-based guidelines that are actionable. And the second is developing multi-country core competencies for advanced nursing practice. I really believe those are the 2 areas that I would like to see us working together on.
Excellent, Dan. Margot and Tony, would you like to make any comments?
Yes, I'd like to make a comment. Yes, I'd like to make a comment. So the presentations were very good, and I, like Dawn, 2 points. The first one, I think overall what I'd like to say is that PAHO put out an excellent document about the formation of doctoral students in Latin America and the Caribbean. And they outlined not only what needs to happen at the institutional level, school level, but also what needs to happen at the country level. And we can't be talking about how to prepare doctoral nurses if there isn't support for that within the ministry, within our health systems, within our education systems. So we need to work together with PAHO to figure out how to change the policies and solutions and to create the awareness that nurses and doctorally prepared nurses are an important resource for the country and for the region. I think once we do that, then the solutions as to how that can happen are easier. We can help support nurses, we can help with curriculum, but we can't create jobs, we can't create the prestige, we can't create the policies. And a number of my colleagues brought that out here. So it has to be a multi-layered approach in what we're doing.
Tony, I would like to ask you something. Thinking about the future, no, and I know that you are in US, but as you know, so many in Latin America, no, thinking about this, what kind of suggestion, you told us about the importance to strengthen together, but in terms of the PhD, the GNP, what do you think about this? And please explain to our colleagues, though, the difference between both.
So that's something that we're still trying to figure out here as well. And I would say we need both PhDs that prepare scientists, that prepare researchers to lay out what the science is for nursing practice. We also need practice leaders, those nurses who have an implementation lens, who know how to interpret data, who need to work interprofessionally to make those practice changes. So it's not an either or, it's a both and. And I think as we're working to develop and even distinguish between the two, we also are on a journey. So we don't have all the answers. I think the only thing that I plead from you all is don't follow our mistakes. The lessons and the context that we traveled, you don't have to. You can advance much further by by building on the lessons that we have learned. So success happens one drop at a time, but with a clear vision of where you need to go.
Sí, gracias, Tony. Es interesante ver.
Thank you, Tony. It is really interesting to see the growth in the number of professional doctorate personnel in this area, academic doctorates, just like we know that there are many people with doctorates in our country. This is an important discussion to have together with all the members of the region, the education of academic professionals, in all of these areas. Thank you so much. Any other comments? Margot, any other comments?
No other
Margot?
comments. Wonderful presentations and echoing the Dean's comments about the need for multi-level solutions and collaboration, and looking forward to partnering and supporting the needs through our upcoming webinars.
And Sylvia, I would like to add, and Margot, you can maybe add a little bit. Margot does provide leadership not only in research, but also in the practice arena. So we are not siloed. We do. So Margot, you might just say a sentence or two about the work as an illustration.
Right, and I think it's important for us to hear the interest in translation and innovation, and that's something that as research focused prepared nurses, that's something we're able to take on as well as our clinical and advanced practice partners. And so in my own research, our team has worked directly with our health system partners to look at the needs of people who are transitioning from the hospital to home. And so at the same time that we've advanced this change, this clinical practice model, we've also been able to evaluate it using qualitative and quantitative methods. And so the use of innovation, interest in implementation science are all things that we use actively. And these are important skills, both at the research intensive and our clinical practice leaders.
Excelente, Margot. And I want to call Dr. Benjamin Puertas. Dr. Benjamin, si quieres poner su comentario sobre la discusión.
Sí, en realidad ha sido una discusión muy interesante.
Yes, this has been a very interesting discussion. And then I have seen the chats, very relevant topics have been expressed in the chats, interesting comments about our speakers. I think there's a series of positive and negative elements here. For instance, one of our colleagues from Ecuador said that, yes, they do have health professions, careers there, where it was regulated, but that was a way to define a transition, order transition, and then within the legal framework. The legal framework is an important point. Many of you have referred in the chats to the lack of opportunity. There are many countries that say they do not have a doctoral program. El Salvador, Ecuador doesn't have any, and even though we have an interesting proposals between the University of Porto Alegre and the Catholic University of Quito, and then we want to make sure that that becomes a model for nursing education, another education faculties or schools in the country. But also, many colleagues have said in the chat that there's a lack of spaces for training of nursing professors or nursing teachers. They have master's degree, they have doctoral degrees, but perhaps there are no resources or there are no or there's no time to really work on this. So I think Bajo support has a wider perspective. We have the vision of policies, how nursing training is incorporated in education plans. Right now, we are advising several countries in the region for development of all of these curricula. And then the fact that we have collaborating centers, Bajo WHO, just like the University of Pennsylvania, and other collaborating centers, I think this is a way to, for instance, to work. Like in the Caribbean, we are working intensely with 3 countries regarding curricula for nursing, and this is something that has been expressed in the chat. The update of this curricula in different scenarios, and not only for programs, we have to insist in postdoctoral education. So that's the topic of the meeting. Many colleagues have expressed all of these points in the chat, and we have to reflect upon this. And then at the same time, we have several universities in Brazil that offer spaces for those interested in studying there. We saw that Brazil has the largest number of postgraduate degrees in nursing. So we are not only commenting this in the chat, but also we know for sure that there are some opportunities. So perhaps the most important thing is something that Bajo has, which is the mapping of the training programs in general in health sciences, in nursing, pharmacy, public health. I think this is an initial way of seeing what we have. Just do our mapping work. And very gladly, we will be able to share this information with all of you in the Caribbean. We just published a document that maps all the training programs in health professions. So that's the supply. Now we have to see demand. Education in each country is different. We talked about, for instance, in Ecuador, and then Ecuador has a legal framework that allows us to advance. So in this combination of factors and thinking of international cooperation, yes, we essentially need to think at the national level, where the national level is where we have to solve many points and many things. And as some of you said in the chat, this discussion in the chat has been very interesting and very rich. Advocacy is another point. the advocacy by nursing, by decision makers, about positioning training programs at the postgraduate level, the graduate level. So, of course, leadership, people in leadership, wonderful if there are nurses in leadership. Nursing should be represented at the decision-making levels, at the highest level. And so this could be a vicious circle, depending on how you want to see it, because the person who makes the effort to insist upon their training without support from the state, and then they reach this decision-making level, that person is in the position to pressure so that, or actually to advocate for these programs, and then vice versa. So we have to really break this cycle depending on what is needed, and PAHO will be able to support your efforts. That's all. Thank you so much. Thank you, Dr. Benjamin. It has been a very productive afternoon with very rich discussion, and maybe in the future we can just talk about the journals of nursing, and perhaps research. How does research reach all the professionals to improve nursing practice? And then to foster this professional practice through evidence. Before finishing, I just wanted to remind you that in November, we have a Pan-American Colloquium of Research in Nursing, and this will be held in Santiago, Chile. Please keep this in mind. Please come to Chile and participate in this Pan-American Colloquium. And also, I wanted to disseminate information about a course that PAHO is organizing in the virtual field, and you can take this in Spanish. And now, very soon, we will be launching this in English. And this course was prepared with the collaboration of our collaborating center of the São Paulo University in Brazil. And this is the scientific methodology and strategies for the dissemination of knowledge for nurses. So this course is available. It is free of charge. And then a certificate is issued, and you can use this as a preparation for students so that in the future they can go into graduate education. Thank you very much to all. Thank you. Thanks to the interpreting team. They have done an excellent work. And please continue participating in these webinars in the Human Resources for Health unit. And we have the intention of reaching each one of you and listening to each one of you. Thank you so much. Thank you to all the more than 520 participants who joined us this afternoon, and particularly to Dr. Margot, Dr. Antonia Villarreal, Dr. Gao, Dr. Nelsie, and Dr. Liliana from Ecuador for your important input in this afternoon. Undoubtedly, we want to express our thanks also to Dr. Benjamin Puertas, the Chief of the Human Resources for Health Unit. Have a nice afternoon, and we finish here. Thank you so much. Bye-bye. See you soon.